The Supreme Court ruling really is going to impact manufacturers in some ways that weren't entirely expected. As you know, it was a kind of a interesting development where we had a lot of buildup for the ruling itself. And the good news for manufacturers is that the big win that they have out of the Accountable Care Act is the expansion of covered lives. But there is now a new wrinkle, and it's a wrinkle that's not entirely clear, and that's whether or not Medicaid might be more limited or that we may see some states opt out of the expansion. If we do see states opt out, then there'll probably be a need for some additional changes actually to healthcare reform, because there could be some patients that are caught in the middle. For example, patients that are below that 133% of federal poverty level are not currently eligible for the subsidies on the premiums because they're presumed to have Medicaid. It's hard to imagine states will opt out of those dollars. The federal government will pay 100% of those costs for the first few years and 90% of the costs till 2020. So it's a lot of dollars that helps the providers within their state. But all manufacturers are going to have to watch this very, very closely, because if we don't see all of those patients become Medicaid eligible, we could have a very large population of patients that are struggling to access anything in the exchanges, may or may not be eligible for subsidies, and really could fall into a much greater uninsured type bucket than we have today, because they wouldn't be covered by some of the normal safety net type components. Manufacturers are counting on that expansion of lives to help offset the investment they've really put forth on the front end of healthcare reform. Manufacturers need to continue to focus on the cost effectiveness and value of their products and really making a difference in patients' lives, because long term, whatever kind of reforms happen are going to have to begin to bend that cost curve. And I think manufacturers that are building that story now are going to have an advantage in the long term. First of all, staying attuned to the changes is going to be critical, because it does impact both long-term and short-term strategies in terms of commercialization of products. Certainly tracking both federal issues as well as state issues is a key need. We may see some states, including very large states like Texas and Florida, differ from different parts of the rest of the country, and manufacturers may have to consider different types of patient support strategies in those states. They may also see patients that continue to need assistance, particularly the low-income uninsured patient assistance programs we thought might actually decline over time as patients really shifted from being uninsured to being underinsured, but that may not happen at the same pace in all states. And then more broadly, we've got the Innovation Center and some other parts of the Accountable Care Act that manufacturers need to stay very attuned to, because they really will move us towards both new payment systems, new care delivery models, but also the potential to have new types of coverage restrictions, particularly for products that don't have a strong value message, are not based in terms of health outcomes. And many products really didn't have to worry about those types of issues before. FDA approval was really the gateway to coverage, and then perhaps reimbursement or prior authorization might be an issue, but not actually restriction of coverage. And we may see that going forward. So manufacturers need to begin building those cases and that evidence now, because even real-world evidence can take a long time to be able to assess and develop and get in the hands of payers, including both public payers as well as private payers. Manufacturers that we've been talking to have been surprised by the news, and everyone can feel a bit overwhelmed in terms of the breadth of reform, not just in healthcare reform, but the fact that there's a lot of unknowns in the future in terms of what other changes will we see made to the law. At AmerisourceBergen, we have a number of tools that we're using to help manufacturers both assess and be prepared for reform, and our consulting group, Exenda in particular, has been working with manufacturers on both tracking and assessing those laws at the federal and state level, but also helping to build product-specific strategies to deal with the different variables. And then, of course, our patient services team, which includes Lash Group and Theracom and Premier Source, are really in the day-to-day real world of implementing tools and solutions. There certainly is a lot of speculation that the elections will impact what we see in terms of next steps about healthcare reform. Will it be repealed? Will it be tweaked and modified, as almost all large pieces of legislation are? And so that next step is critical, and it's going to be important to watch federal and state elections too. And then longer term, I think manufacturers are beginning to look at some very unique partnerships, really outside of the box thinking, and I definitely think there's an opportunity for manufacturers to partner not just with AmerisourceBergen, but also with different types of healthcare providers, because when you look at health systems and community pharmacy, they all could be part of these new types of care models that exist, whether it's accountable care organizations or medical homes, whatever the new models are that continue to evolve. There's going to be an important opportunity for manufacturers to make sure they're part of that, particularly related to supporting patients that are on their therapies. The upcoming elections are going to be fun to watch because there could be a significant sea change that really impacts healthcare reform specifically. So one scenario is that there really is a dramatic pressure to really either repeal or dramatically change healthcare reform as it stands today. That's one scenario, and a very strong possible one. One challenge to that is, the healthcare reform that's passed so far is pretty much focused on patient access. So you could certainly argue it's really at the basic building block. It doesn't include all of the aspects, really of cost reduction and really change in care delivery that's needed. There's some funding to innovate in those areas, but there's not a wholesale change to those care models. So the question is, what do you do to replace it? There's probably another strain of thought, another scenario that we'll see just changes to specific parts of healthcare reform implemented. It's hard to get much done right now before the election, so the period after November will likely be the next busy season. But the Supreme Court ruling has shifted us from really us waiting for that ruling now to this being back to a political issue and one where everyone can have a voice with their elected officials, and I think we're beginning to see that. Manufacturers and providers and certainly distributors like AmerisourceBergen, we all need to look to see how can we innovate to add more value, to reduce cost or improve quality. That really is the name of the game, and we shouldn't wait on any of those aspects. We don't need to wait for the government to create care models. If we can create some of those, particularly in the private domain, we might even help solve this issue on the front end. No matter what happens with the elections, we're going to all have to make some changes in healthcare in this country.